This is the SnapARray tool. It is used as an instrument to obtain radiographs for endodontic purposes. This is the XCP ring kit. It can be used for obtaining full series, additional bite wings, or periapical radiographs. Remember, each of these instruments come in sterile bags and should only be opened in front of the patient once you're set up in the room. Let's take a look at the initial room and patient setup. As the practitioner, you should be in full clinical gown, gloves, mask, and eye protection. Barriers should be placed on each of the sensors brought into the clinic that are going to be used. For example, we have barriers here on our number 2 sensor and our number 1 sensor. If a number 0 sensor is brought into the clinic, it should have a barrier as well. Additional barriers should be placed on the shelf where the sensors are going to rest when not in use, on the tube head, as well as the headrest of the patient's chair. Once you bring the patient into the room, you should place a lead apron on them. If you're doing intraoral radiographs, it is important to make sure that the thyroid collar covers the thyroid gland completely to prevent any primary exposure. Next, handle the sterile bags of the instruments by placing them on a barrier-protected table. Be sure as you open the bag in front of the patients not to touch the sterile instruments with your hands. Once the instrument is on the table, handle the instruments from here on out with a clean pair of gloves. To take radiographs for the anterior, maxillary, and mandibular, have the size 1 sensor ready and place it into the blue tab. Be sure that the blue side of the bite tab and the blue side of the ring are placed together so that you can see the sensor through the middle of the ring. The correct way to place the sensor card is outside, meaning it is within the oral cavity. The side that gets exposed is placed adjacent to the patient's teeth, and then have them bite down. Then align the tube head with the end of the stainless steel bracket. To make this alignment easier, move the ring all the way to the end of the bracket. For the bite wings, there are 2 red tabs. The first, the long one, is for horizontal bite wings, and the second smaller one for vertical bite rings. For bite wings, you need to have the size 2 sensor ready. Place the red tab onto the sensor. You'll find more often that we take horizontal bite wings as opposed to vertical bite wings. Again, it's color coordinated. Be sure that the red part of the ring faces the red bite tab. This is the area where your patient will bite down on the bite tab. Again, the card, the sensor, will be in the oral cavity. Have them bite down and align the tube head accordingly. Aligning the tube head to the ring is important because we do not want to get any cone cuts. For the vertical bite wings, we'll remove the horizontal bite tab and replace it with the vertical bite tab, and then replace the number 2 sensor. So, the area of exposure should be away from where they have the card attached. Place the instrument into the patient's mouth and have them bite down and align the tube accordingly. For the posterior, maxillary, and mandibular teeth, we'll use the yellow bite tab and, as before, the yellow color-coded ring. And we have the surface that is away from the card facing the teeth. Now this is set to take radiographs on the maxillary right side. Once again, aligning the tube head accordingly. And again, you can see that this is a number 2 sensor positioned horizontally in the oral cavity. You do not have to change the instrument settings to move it from the top right portion of the patient's oral cavity to the bottom left. Now we'll look at using the SnapARray for endodontic purposes. First, unlock the SnapARray and place in the number 2 sensor. Relock the handle so that the sensor does not come out, and assemble the positioning devices. Again, place the ring so that you can see the exposure surface through the center of the ring and place it into the patient's mouth. This is the surface where the patient will bite down. And once again, position the tube head to the ring. The same settings of the instrument can be used for the mandible without moving or adjusting any of the settings on the instrument. Upon completion, all instruments should be returned to the dirty side of the dispenser area so that they can be bagged and sterilized. Once the patient has left, put on clean gloves and remove all the barriers. Again, put on another pair of clean gloves to wipe down all surfaces, the tube head and wires with disinfecting wipes.